Thank you, people. I'm sorry I was late. I'd like to call to order the October 7th meeting of the Saugus Board of Health meeting. First on the agenda is the review of the minutes. I take it everybody did have a chance to review?
So Madam Chair, I would recommend that we table both sets of minutes for this meeting and the previous meeting to next month, just so we can compile them. Because we've been working on it over the last couple of weeks. We did have a retire, our longtime clerk.
I'll make that motion.
Yeah, so we're gonna table
the minutes for the
till the next meeting. Unfortunately, we lost Diane, and that was.
I would like to extend my gratitude to Mrs. Domenico for her 10 years of service to the town of Saugus, but I would also like to take the opportunity to welcome our new administrative assistant, Carly Brazes. She started last week. She's been fantastic so far, so we're lucky to have her. But yeah, so so we were going over some of the basic, basic clerical stuff that we're, that we're typically doing from, month to month. And so, like I said, we're going to be working on the minutes moving forward. So we should have 2 sets for you next meeting.
All right, that sounds good. We are going to change the order a little bit. We are very pleased to have, once again, Sean Dunn and Allison Langone from Mass DEP to follow up on the air quality monitoring system that we're having placed in Saugus. Sean, Allison, myself, and John have been meeting weekly via Zoom and have been really working. Sean and Allison have been working to update us on all the ins and outs of getting this air monitoring system. So we've asked them to once again come, and they've prepared a wonderful presentation for us to better understand how it works and what the process is going forward. So without waiting any longer, Sean and Allison, thank you so much for being here. We really appreciate all the time that you put into it, and take it away. Thank you
so much. I really appreciate the opportunity to be here. Thank you very much. Our work is highly dependent on this type of engagement with communities to be successful. So this is really great, this opportunity here. So I'm just going to give a quick update on where we are as far as the air monitor goes, and then I'm going to hand it over to Allison. She's going to talk a little bit about the data that comes out of the sensors and a little bit about the data that's going to come out of the regulatory monitor, but really it's more focused on the sensors that are already out there collecting data. And I did want to introduce Addison, who's out here in the back. He's taking some notes while Allison and I are up here talking, but he's in our community monitoring group, so this is a great opportunity for him as well to see sort of the work that we're doing. So we did meet a couple, I think late August, we met out at the Rumney Marsh Reservation. We met with the DCR, there were some Board of Health members there, some other local officials, the EPA, ourselves, and some local residents, and thank you very much to those residents that came. The idea was to look at the 2 locations that we have identified as potentially being good spots for air monitoring, and to make sure that the DCR was amenable to those locations, and to make sure that the EPA was amenable to those locations. We'll be using EPA funding to install these monitors, and to make sure that the community felt like it was an appropriate location for the air monitor. So that was, I think, a very productive meeting, and the EPA was comfortable with it, the DCR was comfortable with it. And since then, I have met with an electrician just to find out what is logistically possible out there as far as getting electricity out to those locations. And we are currently working with the utility provider, National Grid, to make sure that they can do an installation on either of those locations and understanding what the financial impacts of that are. So we're continuing to work on it. I'm really excited to be where we are at this point. It is unfortunately a slow process. But with that, I think I'm just going to turn it right over to Allison, and she's going to talk again about the data that's coming out of the sensors that are out there, and a little bit about the data that will be coming out of the regulatory model.
Hi everyone. Thank you so much for inviting me to come speak. Thank you, the Board of Health, for inviting me here. I'm really excited to talk to you guys. I'm going to talk for about 10 minutes, and I'm going to go over air quality standards and a little bit about how Mass DEP interprets the data that comes out of air monitors. So to get us started, this chart, it's a little hard to see, but I'm going to be repeating these numbers a lot. This is a National Ambient Air Quality Table, otherwise known as the NAAQS. If you ever hear me say NAAQS, which I will say a lot because we love acronyms in the government, NAAQS stands for National Ambient Air Quality Standards. And these are air quality standards that the EPA has set, the Federal Environmental Protection Agency has set as health protective standards for certain air pollutants. I'm going to zoom in a little bit here on our pollutant of interest. For the Saugus air monitor, we are going to be monitoring for fine particulates, as well as larger particulates as well. But for this presentation, we're going to kind of go over the fine particulate standards here. So you can see that we have an annual standard of, whoa.
Oh no.
Oh, power outage.
Okay, guys, see ya.
Yeah.
Oh no.
It's 9 micrograms per.
Oh my gosh. Wow.
It was just a
Weather
laptop that did.
update.
Oh man.
Wow.
We actually lost power.
Yeah. Oh, no.
And we're back.
So I think we'll have to wait until that boots back up so we have the remote.
One of the interesting things about the NAAQS that Allison was just talking about, and particularly as it pertains to the work that we're going to be doing in Saugus, is the fine particulate standard was recently lowered for the annual average. So she's going to show there's a couple different standards associated with PM 2.5.
Oh, man.
And the annual standard was recently lowered. The EPA decided to lower it from 12 micrograms per meter cubed to 9 micrograms per meter cubed to be more protective of human health. So that's the standard that we'll be looking at here today.
Okay.
Good recovery.
This is exactly where I was. Okay, great. Yes. The EPA sometimes, so these standards are based on years of rigorous scientific research, and when new evidence comes to light, the EPA will reevaluate the standards on a periodic basis. So they did change the annual standard from 12 micrograms to 9, so it is more health protective. At the same time, they chose to not do anything to the 24-hour standard, so that remains. This 24-hour standard is the smallest time resolution that we have for an air quality standard for fine particulates. So this is a 24-hour average, and that standard is 35 micrograms per cubic meter. And that's just a concentration, that's what that unit at the end means. So this 35 microgram per cubic meter standard basically means that if our monitors, our regulatory monitors, if they register a 24-hour average over 35 micrograms per cubic meter, that is considered an exceedance of the standard. And so we typically do see exceedances when we have like wildfire smoke events, because during those events we're having continuous elevated particulate event, and so that PM can be elevated for a day or multiple days at a time, so we can start to see exceedances of the 35 microgram standard there. However, there is a big difference between an exceedance and a violation. So a violation, you can see there, maybe it's kind of small, but it says 98th percentile averaged over 3 years. So we actually need 3 years of data from a monitor to get to be able to consider something a violation of this standard or not. So again, difference between exceedance is exceeding 1 time or 2 times, that's just an exceedance of the standard over 24-hour period versus a violation which needs 3 years of the 98th percentile average. also go into a little bit about what a 90th percentile is. So basically, if you take all of the 24-hour average data for an entire year and you organize it from smallest to largest, the 90th percentile value is the concentration at which 98% of the values, the majority of the values fall below it, and only 2% of the values are above it. So we take the 90th percentile for a year, and then we do it again for next year, and then the year after that. So we get 3 of those. We get 3 of those 90th percentile values. We average it together, and we get 1 value, a 3-year average. And just to give you some context, these are our highest 2 sites in Massachusetts. We just did our 2023, we finished up our 2023 air monitoring, and so we have the 2021 90th percentile, 2022, and 2023 average together. You get this 3-year average of 21 micrograms per meters cubed. These are our 2 highest sites in the states, and they are well below that standard of 35 micrograms per meters cubed. But we also have something called an air quality index, and so basically we use the NAAQS, those ambient air quality standards, to convert concentration data into an easily understandable metric, and that's called the air quality index. So basically the concentrations are on the right-hand side there, listed for each breakpoint. So if a monitor is reading between 0 and 9 micrograms, that's an AQI of between 0 and 50, and it's considered good air quality. You can see the breakpoint between the moderate, where's my mouse? The breakpoint between the moderate and the unhealthy for sensitive groups is that 35 micrograms, is that exact same 24-hour standard. And so it basically, as these monitors are reading concentrations, it translates into an air quality index, because it's easier to understand than 8 micrograms per cubic meter. And so when you go on a website like Air Now, we can get air quality information in near real time. So maps like Air Now will take hourly data from our air monitoring stations, and they'll display the associated AQI. I wish this was a little bigger, but each one of these dots has a color and a number inside it, and when there's an air monitor in Saugus, it will also populate on a map just like this. It will be on the Air Now map, it'll be on our Mass Air online website, and you can see all these different dots. Most of them are green. We do have one that's yellow here with 51, that's moderate air quality. So that's how the standards are used to translate into an air quality index. There is no 1-hour standard. So the shortest time period that we have is that 24-hour standard. So even though these are 1-hour averages that are being contextualized for people to see how polluted the air is at that moment, we don't have a health standard for 1-hour averages from EPA. So now I'm going to jump in a little bit to talk about some air sensor data. So in a couple of slides, I'm going to present some data from the Lobsterman's Landing purple air sensor. If you weren't aware, Saugus received some purple air sensors a couple years ago from a grant from Mass DEP, and they put up one of them at the Lobsterman's Landing site. And there had been some interest in that sensor. But I'm just going to talk a little bit about the data that I'm going to present. So I'm going to present corrected data. And I just wanted to explain what that meant. So this is data from our regulatory air monitoring site in Roxbury. And you can see this green line here is raw purple air readings. And this blue line here is what our regulatory instrument was reading. And you can see that purple air kind of overestimates the concentration of PM2.5. But there is a correction factor that we can apply to the data. And it's a mathematical equation that was developed by EPA. And all it does is really make purple air data read closer to what a regulatory monitor would read. And so when you apply a correction factor, you get data that is much more in line with the T640, which is the regulatory instrument, the same instrument that we'll be installing in Saugus. And it's not perfect, but it's certainly a lot more in line with the regulatory readings. So it can just really help make sensor data more useful. So now here we are with some Lobsterman's Landing sensor data. So this is, again, corrected data, but this is 2-minute data. So every 2 minutes, the purple air is taking a reading, and you can see I'm contextualizing it here with this dotted line. I don't know where my mouse is. This dotted line. That is 35 micrograms per meters cubed. So you can see there are 4 periods here. This is from August 22nd to September 16th. No particular reason. It was just the period of data that I pulled. And so it's a little over 3 weeks. And there are 4 instances here where we're seeing spikes where the data is going over 35 micrograms per cubic meter. And these are very short-lived spikes. So each one of these spikes is either 2 or 4 minutes, because each one of these data points is representing a 2-minute average. And so we can see that these very short-term elevations actually don't really have very big impacts on longer-term averaging periods. So we're going to take this exact same data and we'll show it on the hourly scale. And here's that same exact data on the hourly scale. And we can see that 3 out of 4 of those spikes have averaged out. They are not exceeding that 35 microgram per meter cubed. We do have this one spike here that turns out to be about 56 micrograms per meter cubed for 1 hour. Remember, unfortunately, we don't have an hourly standard. So if we were to transfer this into an AQI, that would be it would be just over that line for unhealthy air quality for that hour. So if you are somebody who has pre-existing health conditions, it wouldn't be a bad idea to take those personal precautions, maybe limit your time outside if you're seeing that value. But as you can see, it was a really short term elevation in the data, and it was a very short-lived impact to air quality. So it was a high for 1 hour, and then the concentrations quickly dipped back below. So we're going to take it one step further. So we had our 2-minute data, and now we're going to go to our hourly. And here we have our 24-hour average data. So this is the data that we can actually compare to a health standard. And when we do this, we see that we actually don't have any exceedances of the 35 microgram per meter cubed standard. So this is not to say that those shorter term excursions did not occur. They were measured, and if you are somebody who's particularly sensitive to air pollution, it is reasonable to take personal protective actions. It's kind of similar to how, you wouldn't spend extended periods of time next to a campfire or a grill or take a walk on a really busy road if you were somebody who is sensitive to things like that. But this is really just demonstrating how short-term spikes in particulates from possible localized events don't really show up when that data is averaged out over longer-term intervals. And it's important to note that it's these longer-term intervals, like the 24-hour averages and the annual averages, that we at Mass DEP use to evaluate when determining health risk and determining violations of standards, because those are the standards that we're given. It's 24 hours and annual averages. And then I just have one more slide here. And this is my last slide, and I'm just demonstrating here that the Lobsterman's Landing data, the exact same data that we've been looking at, is actually very similar to what we were measuring at our Lynn site, which is that's probably the closest site to here. This is at the Lynn Water Treatment Plant. We have a T640, one of those regulatory instruments, and we also have a purple air sensor as well at the site. And we're seeing very similar levels, and I wanted to point out here too that that spike on the 14th, where we had that really high hour, was also seen at Lynn. So, it elevated at Lynn a little bit too. So, it's possible that could have been like a regional thing, or, not something completely hyper-local. So kind of zooming out when looking at air quality is really helpful. How is it reading compared to other sites? Yeah. That's all I have. That was my last slide, and I'm more than happy to take questions or go back and show y'all anything else that if I went too fast. Yeah.
I'm just curious, is that purple air monitor, is that corrected, or is that?
Yep, yeah, this is all corrected.
That's all corrected.
Yep.
When you see spikes like that are, in Lynn and, sort of area-wise, not just one monitor, do you look back to see if there's something going on in a region? Was there a fire reported? Was there a weather condition? Was there something that could be linked to that? Is that part of the, data, it's part of the investigation that you do with the DEP?
Yeah, absolutely. So we, with our regulatory sites, we have like what we call buddy sites. If we go back and look at this map, you see there's a lot that are in Boston or close to Boston. If we see something like elevated at our Kenmore Square station, we'll pull up the data for the Roxbury and the Dorchester, and even, as far out, Chinatown's in there too. There's so many stations like right there. So we definitely compare, and we call them buddy sites, and to try and see if that data is spiking at other sites. Definitely localized fires can certainly be, we definitely have to do a lot of Googling around the area. And sometimes there is no apparent explanation. Sometimes we see things that are happening like overnight. Maybe there's a truck idling and, it's just specific to that site. So as long as we're certain that, our monitors are operating correctly, the data kind of just is. But we'll always investigate to see if we can correlate it to see if it's something localized or something that we're seeing at multiple sites. Hope that answered the question.
Thank you. Yeah.
Madam Chair?
Yes, please.
Just first of all, thank you,
You're welcome.
Allison, Sean, Addison, thanks. We have great people working at DEP, for sure. But I just one question, and this is so helpful for us in looking at the purple air monitors and once the air quality site goes in to compare those things that would really be helpful. The slide deck, I think is really fabulous. Can you share it with us?
Sure.
And we can share it with the rest of the board?
Absolutely.
Thank you.
I have a question, Madam Chair.
Please.
So Allison, you mentioned a little bit about exceedances versus violations and what have you. My only question would be, when there is a documented violation to any of these, once the air quality ventures into the violation area of enforcement, my question would be, what actions do the DEP take, and what actions do the EPA take as far as rectifying those types of violations, or enforcing some type of?
Yeah.
There is, that's when it gets out of our hands.
Okay, sure. No, that's
but there
my
is
question.
a state implementation plan that addresses those situations, and there is a whole process that you have to go through.
Sure.
And it is exhaustive.
Oh, sure. It sounds like it's
Sure, yeah,
yeah.
extensive, for sure.
Yeah.
All right.
Thank you, Allison.
Sure.
Did anybody have any other questions in the?
I just had one. What happens, once that violation happens, does the Board of Health get notified of the process that's taking place?
So an exceedance or a violation, like where you'd be, taking getting involved with the EPA, is that right? Yeah. So, to be honest, I don't know what the notification process is with that. But again, that's when it gets out of our hands, it goes to, the folks in Boston that are responsible for implementing the state implementation plan. We just do the monitoring.
It'd be nice for the board to know, but also if there's a public site, to at least provide it to the public. If there's an Air Now site, if there's an equivalent to say, oh, I'm curious what's happening, it'd be nice to have that, even if it's not right away because it's exhaustive.
It would also be published we publish annually an annual report that summarizes all of the data from our network by year. So we actually just published last week our 2023 annual air quality report. That's available on the DEP website, and it shows a summary of the data from 2023. It also shows 10-year trends in all of our sites, and so it would be included in that report.
Thank you.
Sure, great question.
Terry?
Yes, so when you have seen the levels go above 35, where is there somewhere that this usually happens? Like, is it near an airport? Is it near factories? Do you see some sort of trend, I guess?
It's a good question. So as long as I've been working here, I've been here for about 5 years, I've only seen exceedances of the standard when, and it's a 24-hour standard when we have wildfire events. And in those cases, it really depends where the smoke layer is coming. Sometimes it just stays over Western Mass. Sometimes it could just be on the top of the state. So that's the only time I've seen it. I actually, like, that's the majority of the time. And then I have seen it one other time attributed to like wood burning smoke. We had it just at one site in Western Mass in December, and wood smoke, people are heating their homes, and it can cause, you know, a lot of smoke in one area. So I haven't really seen it. I don't know if, Sean, you've seen it any other times.
Yeah, I think what you said is really great.
Yeah.
In Western Mass, in the Connecticut, or the not the Connecticut, but the valley
Yes,
that goes from Greenville down to Springfield, that's where wood fire smoke can collect, and so we put our monitors out there specifically to look at wood fire smoke for people that are heating their homes with wood. So that was an area prior to getting impacts from Western U.S. wildfires or Canadian wildfires. That's where we would see the majority of our exceedances. But with the Canadian wildfires that we had last year, you know, those at times would cover the whole state.
So I'm curious, so we had a fire in Breakheart, was it a year ago, 2 years ago?
Sure, a year ago, yeah.
So did we have the monitor then, and I'm wondering if that changed at all?
I don't know if those were, I don't know if the purple air sensors were set up during that event. We did have the Lynn site during that time, and we did not get any exceedances during that particular event.
So topography of the land is going to play a major role as far as what you
Weather
see.
really plays a huge role in it. Wind,
Sure.
you know, if
Obviously you see in
Get
LA
strong
with
wind,
smog
yeah.
because of
Yeah.
the giant valley,
exactly.
but-
And even those regional events with the Canadian wildfire smoke, it's, you know, the topography, like you said, and the weather patterns that are carrying that smoke really determine who's going to be impacted and how significant.
This is also why, like, a website like this, I mean, this is going to show you the hour by hour, you know, concentration. So even if you're not exceeding the 35 on the 24-hour, you might have a couple hours that are exceeding the 35. And if you have asthma, you have children, elderly people, you want to pay attention to that. So having a website like Air Now, and we also have our website, Mass Air Online, will show you hour by hour. So, you know, it doesn't have to be just an exceedance to be like a thing. You know what I mean? Like, we can still have hours that are higher than others that you might want to pay personal attention to.
So Sean, in your experience, now you mentioned that once there is a violation, it's like, okay, we're sending it up to the state and that's it, you know, or the people in Boston or what have you. In your experience, have you had to do that as far as, have you seen like areas that have been in violation where you've sent it up to the EPA and just said, okay, have at it?
That's a great question. We have not.
Okay.
We've been in attainment with all of the EPA standards for this pollutant and the other pollutants for, geez, it's probably been 10 years. We used to have an ozone issue, but that hasn't been a problem for us for several years now, which is great.
So now, when there was an ozone violation and the EPA got involved, can you tell us a little bit? I mean, you're obviously digging into the archives here a little bit.
Yeah.
You know, but as far as the enforcement actions from the EPA for an ozone issue, now would that be a similar thing to if there was any type of violation in this area for as
It
far
was
as
more broad than localized,
Yeah, okay.
type of action. And this is going back before my
Sure,
time.
yeah, no, I know you'd be
working.
it's historical kind of, yeah.
But all of DEP's policies, you know, when it comes to emissions, are sort of related to meeting these standards. So, you know, the work that the state did, you know, 30 years ago to reduce emissions around the state really led to us gaining, attainment with all these air standards. So you know, you can look at the tables that are in that annual network plan and the previous historic the reports, the annual air quality reports, are also published on there. So you can go back and see earlier reports, and you can see really significant declines in the amount of pollution around the state over the years. And that's all related to Massachusetts, dedication to regulating emissions and lowering those emissions from vehicles, from stationary sources, and it's all led to us, having much better air quality.
Yeah, it sounds like it's more of like a promulgating regulations type of involvement versus any type of direct, like punitive measures.
Exactly.
Yeah. Okay. Thank you, guys. Sure.
Was there?
That was my question.
Okay.
If there had been any violations.
Yeah. Thank you very much, guys, for having us here and working with us. We don't get this kind of support at every community. Some communities don't want this information, but I think Saugus has been an amazing community to work with, and we really appreciate it.
Just one last question, Sean. So as far as, do you have any idea on timeline?
Oh, yes, I apologize. So we're sort of targeting like a spring timeline for the air monitor. Like I said, we're working with the utility right now on getting electricity, and that's sort of nuts and bolts. What is sort of the most important next domino to fall is making sure we can get electricity, and then if we have some sort of agreement on a location, then we'll start to proceed and would be targeting a spring timeline.
Great.
Thanks.
So,
thank you so much.
If I may, I think when we hear from the electrician and the utility company, I think when we get the best.
What's the most pragmatic solution?
Yes,
Yeah,
I think then we can make the, on our next Zoom meeting after that, I think we can make the decision on what the best location is. And then, but after that, I think it's just gonna be a matter of installation and.
Yeah. That's the
Pushing the rock over the hill.
Yeah.
All right.
Yeah.
Awesome.
Yeah, great. Thank you guys again.
Thank you.
And we'll look forward to our next
Guys, thank you.
Zoom.
We'll talk soon. Okay, Sean.
All right, thanks, guys.
All right, thank you. All right, so I think that was a great meeting. Take care of it.
We'll send you the slides.
Perfect, thank you.
Thank you.
All right, so next up, we have Wind Waste. Good evening.
Good evening, Madam Chair, Director Froelich, and the rest of the board members. I'm here to provide an update since the last Board of Health meeting on September 9th. So since the last meeting, the facility operated at approximately 81% boiler availability, processed just over 27,000 tons, generated just over 15,000 megawatts. The facility had 3 unscheduled downtime events totaling 136 hours, and 1 scheduled downtime event that was approximately 120 hours. Since the last Board of Health meeting on the 9th of September, the facility has shipped just under 4,000 tons of ash to the Wind Waste Shrewsbury landfill. On the 16th, the Mass DEP contacted the facility regarding some pictures that were taken from Revere, claiming there was smoke coming from the building. The management team verified with the rest of the operations, did a thorough review of the continuous emissions monitoring data, opacity data, that there was nothing operationally abnormal, reviewed cameras, everything, nothing out of the ordinary going on. Just to note, different weather conditions can lead to the steam vapor and stack plume being more visible and pronounced, which we believe was the case then. We were also supporting the Massachusetts State Police. So on like a quarterly basis or so, they do a sobriety checkpoint. So they did have the whole building and parking lot kind of lit up as part of that, which could have led to some questions as well. On the 20th, the facility submitted the stack test report to the board, and the 10 tests related to emissions. The results show that we were significantly below the DEP emission limits in every one of those categories. That testing is completed by an independent third-party contractor, observed by 2 Mass DEP representatives, and Tech Environmental as a representative of the town of Saugus. On the 24th, the facility called the Saugus Fire Department to report a fire at the compost area out at the Montefiore. The fire department arrived at approximately 11:20 p.m. And the majority of the fire was extinguished at approximately 11:45. The facility, we supported with a loader to help work in conjunction with the Saugus Fire Department, continuing to rotate the compost material and wet it down to prevent any further flare-ups. We performed a root cause analysis with the contractor that manages the monofill and determined that the dry conditions and the high winds, coupled with the natural heat and the newly delivered residential grass clippings, caused that to rise, causing the fire. The monofill operator has rotated the compost piles again, and we'll be working on scheduling the grinding of the material at the end of the season here. The facility did not have any excess emission events or radioactive loads since the last meeting. On a community note, had another great day at the Founders Day event. Members of the team enjoyed talking with the hundreds of people who stopped by the booth to say hello, learn more about the operation and Bear Creek Wildlife Sanctuary, as well as grab some jars of the honey. Follow-up from last meeting, Mr. Duran and we had talked about a couple different things. Just so you're aware, so now on the ASME, the licensing program, we officially have 5 chief facility operators, 6 site-specific operators, and I have 4 employees working on their provisional licenses. And then the other thing that to follow up, we're waiting on the contractor that supports the mowing. He's supposed to be out there in the next 2 weeks, so once I have a date, I can follow up officially with that.
Thank you.
Thank you. Any questions from the board?
I have a couple of questions. On the you mentioned the did you get a report of excess emissions? Or
No.
how did that come about, and then you checked all your CEMs?
Yeah, so
And you didn't see any problem? How'd that come about? And what time of day was that?
Joe can speak to it because he was contacted.
By, Mark Fairbrother, the section chief for the Solid Waste Division of Mass DEP.
Okay.
He gave me a call that Monday morning and just said they received an email with pictures over the weekend and asked me to follow up on it.
And did they have the time and date of that complaint, and were you able to establish
Yes. It was
that time frame in your CEMs?
It was the Friday evening, the previous Friday evening.
It was Friday evening, okay.
Approximately 11 o'clock.
There was no downtime during that time? Okay. I have another question, if you don't mind. We received a water waste application for dredging.
Yep.
Was the Board of Health notified, or is it just not practice for the Board of Health to be notified on something like this?
This is just the start of the permitting process, so this is essentially the notification. This project won't take place essentially until November of 2025. So we're going through the process of permitting with Mass DEP, Army Corps of Engineers, and then the Board of Health is notified along the way as those permit applications are submitted.
So what's the purpose of the dredging? And
the purpose of the dredging is to restore the original channel for the cooling water intake to as designed. So it's a maintenance dredging. It's done periodically every 8 to 12 years.
So is the intake separate from the discharge?
Yes.
Or are they in the same general area?
No, they're roughly 300 yards apart, maybe
Yes,
more.
somewhere in there.
So this has nothing to do with the discharge area?
Cooling water discharge area?
Cooling water discharge
No.
area?
No, it's only the intake.
Okay. And is the intake impacted because of dredging? Is that the reason why you have to do it?
It's just a general maintenance practice. As sediment will build up over time, and to keep that area clear, we have to dredge periodically.
Thank you. I have one other question that maybe you'll be able to. So I was looking at the annual report and had some questions on it mentions landfill closure. Aside from other things that we report, there were some other issues in the annual report of other reports that you either submit or whatever. And it mentions landfill closure and post-closure cost estimates. So it brought a question to mind. Are you required during this period of time to submit any landfill closure documents? Have you submitted any?
Annually, we submit what's called the financial assurance document that shows that we have a surety bond in the amount it would cost. If we were to say, close up shop and walk away, the state takes that money to then take care of the monofill from that point forward. And that's submitted annually or updated annually.
So you haven't to date submitted any potential applications or anything like
For
a closure plan
No.
for the landfill?
No. Included in the annual report is our life expectancy, but no closure plans.
Yes. Okay, thank you.
So is that, thank you.
Thank you.
Thanks, Ally.
Next, we have a tobacco suspension hearing.
So, Madam Chair, we were provided a inspection report on, that was conducted on 8/11, so August 11th, and we yielded some violations at Blue Moon Smoke Shop.
Okay.
According to our tobacco control coordinator, this is their second violation within a 36-month toll period. They have since paid their $2,000 fine, but the state CMR suggests a 1 to 7 day suspension.
Okay.
And so I think we have Joyce here tonight to talk a little bit about the violation and what it entails.
So your local regulation already includes a decision on 7 days since earlier than 2016.
Right.
So that's
Right.
within the framework. The other thing, I just want to tell the board and anyone who's listening that I have a lot of concerns about the two establishments that are before us tonight, because part of the adult-only permit is that a person under 21 isn't even allowed on the premises.
store, right.
And this is state law, as well as local law. So the youth was allowed to get in there, obviously to buy, right? So the sale to a minor. But they also got 5% nicotine, which is the higher level of nicotine content. And that is what delineates them from being like a regular convenience store. They get the higher levels, they have access to higher levels of nicotine. Young people shouldn't be in there and certainly not sold to. So obviously I encourage you to uphold the 7 days, but also maybe we can, if there's another violation moving forward, that they call the owners before the board. And there was also a DOR violation there in the same month. So just when you look at it holistically, this establishment is just not up to, the highest standards.
Okay. So, remind me where Super Petroleum is?
So they actually, so I would recommend to the board, and obviously we're going to, attack these agenda item by agenda item.
Right, I'm sorry.
My suggestion would be for Super Petroleum, unless there are representatives. Are there any representatives from Super Petroleum here tonight? Because we haven't received a receipt of confirmation of their notification to hold a suspension hearing. So that being said, what my recommendation would be is to table this until next month, where I can go down and hand deliver something to them, just to let them know that we are going to be holding. I mean, just as far as a completion process is concerned, we want to make sure that we've crossed all of our T's. So my recommendation would be to table the suspension hearing until next month, so there are some representatives here.
Okay.
I have a question for you on that note. What date would that meeting potentially fall on?
So the prospective meeting date for November would be, I'll tell you right now, the 4th of November.
Just asking, think I told you I'm out on medical.
No,
leave.
sure, no, absolutely,
And I
Trish.
just wanted to provide information if I couldn't be here, but I will be here.
Great.
So,
Thank you.
Okay.
All right, okay, so I guess I went out of line, I'm sorry, out of order.
So we do have some representatives here from Blue Moon
Okay.
Smoke Shop,
Okay.
and I believe they'd like to speak a little bit about what the situation is.
Okay, come on to the left.
Sure, absolutely, come on up.
Good evening, members of the board. My name is Attorney Brent Bass. My office location is at 220 Broadway, Suite 402 in Linfield, right over on Route 1 South. I do stand as a representative for Blue Moon Smoke Shop. Malik Hyatt, the owner-operator of the facility, is in attendance as well. He is aware of the significance of the event. You know, one of the things that this owner has always encouraged his employees to stay abreast of the regulations that not only Saugus has, but the entire state. Those regulations are actually provided to each employee. They are on location in the store. And he does the utmost possible to make sure that the employees are trained in the regulations that supervise them. In the situation before the board, he's not contesting that a sale took place, even though I, as an attorney, would certainly like a little bit more information, photos, receipts, certain other things that are indicia of that sale. But taking that aside, what we're more here for is to find out what further compliance and controls that this location can take so that we stay in accordance with what's required. We're certainly standing here before the board asking that the discretion for the 7 days, and it is a complete discretionary standard under the law for the 7 days, is that not be taken, to allow this operator to go ahead, install further controls, and be able to move forward with his business so that he can do what needs to be done. Furthermore, as far as checking the events of that day, the employee that was on staff that day that did allow these events to occur has been terminated. The most that as an employer we can do to said employee, and we do ask the board to do note that it is an employee. It would be one thing if Mr. Hyatt had stood at the counter as the owner-operator and made an egregious violation. Here, the employee, even after all the training that could be provided, still allowed it to happen. You know, certainly in checking with the police department, there was no information provided to them so that they could proceed under Chapter 270, Section 6A, which I know a lot of the towns have been moving forward on when they do have these individual clerks that actually allow a sale to minor to occur. That's another available remedy as well that I think allows some responsibility to go to the offending actor rather than putting the full onus on the owner-operator themselves. It's sort of a strict liability position that I'm not sure that the state statutes are encouraged, nor would that be the intent of it. So as we stand before the board, knowing that this operation, it is their second one, but it has been many months since their last violation. They have taken the number of controls. They have card scanners available to the clerks. They know the procedure. They know that they're not supposed to allow people on site into the facility without doing the card scanning process before they are too far into the location. Other than that, there's not many further technological forms or devices that the owner-operator can employ. So again, we're really standing before the board asking for recommendations of what it can do better in the future to make sure this doesn't occur again, and further to ask the board to utilize its discretion and make a non-suspension of a license, or in the event that it feels that it must do so, to reduce that suspension to the minimum number of days possible.
I don't know if you answer this. How was the violation recognized? Was it an undercover operation, or was it?
So Joyce, maybe you could
Joyce.
talk a little bit about the procedure for doing compliance checks.
So we conduct compliance checks, and the retailers who get a local permit agree to unannounced compliance checks. Our youth are trained, this particular youth, both for FDA and DPH training approved. We take them out, I escort them as the adult. They don't have any ID, they carry the money, only we give them. The only thing that's their own that they go in there with is a phone. In case there's an emergency, I can be contacted. We tell them what to buy, give them the money, and record it when they come out, what was sold, what was said, and who sold it to them. Take a description of the person who was the salesperson. And in this case, like I said, I have the photograph of the evidence. And we don't get receipts, and I would challenge anybody in this room to go to any convenience store across the state and ask for a tobacco product and see if you get a receipt if you're using cash. So this is the evidence from this establishment. It's a electronic cigarette, 5% nicotine.
I don't buy cigarettes. Did I understand you last time you said they have to produce, they have to have an ID scanned?
Yeah.
And in Massachusetts, in state law, it's not scanned. They just have to check it. Every person, every time. That's the state law. And in fact, they shouldn't even be getting through the door, but every person, every time. We call it the Fenway rule. Like if you go to Fenway,
Yeah.
you, me, you get a beer, 10 minutes later you go up and get a beer, you're carded every time. Doesn't matter if they know you, don't know you, pull out your ID. And our youth do not carry IDs.
So in this case, he was not checked an ID?
No.
So Joyce, in the violation narrative that we sent out, I also note that he undercharged for the product?
No, that was Super Petroleum.
Oh, excuse me, am I looking?
That's okay.
Oh, okay.
Yep.
That was going to be a follow-up question.
And this was the second violation?
Yeah.
Yes,
And when
and
was the
they
first?
served, it was on June 15th of 2022. There's a 36-month tolling period, meaning we look back, or if this were the first, we look forward. And they served a 7-day suspension for that violation as well. And the reason why it's not $5,000, being a third, is their first violation just ticked out of, by literally 2 months, ticked out of this being their third violation. So you can potentially have 3 second violations if they're all relatively close.
And if I,
Joyce, excuse me for a second. As far as the request by the attorney for further suggestions for more, safety checks than that, I personally, I don't see what more we can do other than training, which they say they have done. I mean, it's a simple thing. No ID, no tobacco.
And in this case, if it had been an adult only,
Yeah.
it would have been a violation even if they
being in the store. So, I don't. It's not. I just can't think of anything else that would be, what are your thoughts, I guess I'm asking?
Well, my first statement that I go public with is we're not in the business of running their business.
Right.
They're employees, and just like food establishments, if someone serves something and there was something wrong with their employee, it goes to them. The person is the permit holder. My one recommendation, it's in state law, is that they say a buzzer at the door. And I say this all the time, not to sound crass, but an adult-only establishment comparatively would be a strip club where they ensure that nobody gets through the door. And that's the criteria that an adult-only establishment actually has to live by. So without being in the business of running the business, that would be my recommendation. And that way, or have someone stand at the door, and if they're only gonna have one employee, pull the register down toward the door, so as soon as someone walks in, you say, if you don't have an ID, turn around. Those would be my recommendations, but like I said, I'm not in the business of running the business.
So Joyce, in previous violations that we've had, I remember there's been a few situations where the employee override system has played a role in, just being able to bypass and sell. So I don't know if that's something that we might want to think about employing at this particular establishment, given that, it sounds to me as though if if there were fail-safes involved, that this sale may not have happened. So, I mean, I don't know if that's something you can disable as far as overrides are concerned, but ultimately, I feel as though that would probably cut down on the amount of violation that we do see, Malik. So I don't know if you have something you might want to.
We have done. We have.
Why don't you pop up here for a second?
What we did, we have taken all the precautions possibly can be taken. We have installed the software. I pay $100 a month for that. They have to check the ID. No tobacco sale can happen without checking the ID. But what happened, when employee is lazy enough or he's not feeling good, so he override it. What he did, he used his ID or the information of his date of birth. That's what they do. And I cannot control anybody personally sit over there. Anything possibly we can do, we did. The only thing we cannot do if the employee is in a bad mood and he's lazy enough not to check the ID, we don't know how to control.
So in this particular instance, then the employee,
This is what it happened.
in question scanned his own license just to make the sale.
Just to let it go. Because he's lazy enough to even ask, can I see the ID?
And again, I think that's where I was sort of pointing towards other corrective measures, punitive, if you will, for an individual that does in fact break mass state law by making the sale. So it's not a restaurant situation. It's an actual clerk that has an individual duty under the law not to sell it to the minor and can be held criminally liable. That's why we asked whether that had been brought to the attention of the Saugus Police Department, if such an egregious violation triggered that. And it is something that is not taken lightly anymore, especially in the North Shore towns that I've been in front of. The police prosecutors are utilizing that statute to actually enforce it against the clerks in the town. And I think that lets both the clerks and the store operators know that there's bi-level and bifurcated liability that is associated with those transactions.
If you visit the store, I'll show you all the precautions we took, all the software we have installed. Possibly whatever I could do, I did.
I definitely feel for you, but I don't think it's up to the board to make a determination that we're gonna. It's ultimately the permit holder's responsibility on who is they're gonna get to sell their products.
You're
vetting your employees or whatever. We don't run the business, we issue the permits. This smoke-free generation is a huge thing that everybody is working towards, and I mean, it would be my recommendation to go ahead with the suspension, I'm sorry to say, and I don't know how you feel, John.
Because we already paid $2,000 as a fine. And if we use to spend whatever is spent, is another $4,000 or $5,000 in this given circumstances, it hurts a lot.
I understand, but this is not something that just happened on a one-time basis. This is something that's happened. This is the second violation within the period of time, and a third one happened just 2 months before. And I'm sorry, I don't make the rules. I'm just obliged to enforce them as they're presented by the experts.
Madam Chair, if I could just also add, this has happened in about 3 locations, probably in the last year, where an owner has either reported independently or our youth have reported that they used, in this case she didn't, but if he's saying that his own employee did, I believe him. One of the recommendations I would make is you have a POS machine, and if your employees are if you check your POS and notice 5 times in a night that this birthday keeps coming up, it would be an opportunity for you to talk, because if he did it once or she did it once, there's a good chance that might be reoccurring in your establishment, and your POS would certainly tell you if somebody is using the same date of birth all the time, which would be highly unlikely that an employee in the same day or even, well, not the same week, but the same day came in and used the same birthday. So that's another recommendation that I've made and put out. It's like, you have control of your POS. And that's about the only thing I have to say. And none of our 16 municipalities, North Shore and Cape Ann, who you're part of the collaborative of, a member of, use we find the employee. I mean, if they left, they'd be gone, there'd be no way for us to track them down. That's not something boards of health are doing, and the police certainly aren't interested in being part of the enforcement of the tobacco regulations.
Well, the issue, Malik, is that this is going to be the second suspension that you served. I mean, ultimately, we have to look out for the best interests of the town of Saugus as far as what we do as far as enforcing these types of regulations. They're stringent for a reason, I mean, they were updated whenever they were updated, I think 2017 or what have you. The CMR was updated to make sure that these types of violations, when they occur, are actually going to deter businesses from this continuing to happen. Because ultimately, I mean, put it this way, if this is the situation that happened and you just kind of got a bad apple and he was just lazy about it and scanned it, ultimately that's just something that, you just kind of, it's an unfortunate situation, but you do have to kind of eat that as the employer of the person, So ultimately, my recommendation would be to continue on with the suspension. I mean, it's not something we're trying to do as far as hurting your business is concerned. I understand that there's a monetary value as far as what you are going to be allowed to sell for that week, but ultimately, if this was a one-off thing, it'd be different. But ultimately, this is now going to be the second suspension that you're serving. So, ultimately, again, it stinks that, it's such a, high number as far as the fine is concerned, but it also stinks that this is happening now after you've taken all these preventative measures and you just happen to get an employee in there, because I know I've been in there many times where it's been, I mean, you seem to run a tight ship, and ultimately the situation that's now unfolding is just, an unfortunate event that unfortunately, we have to enforce a zero tolerance policy as far as this is concerned.
No, you're right, but already paid $2,000.
No, and I
think for this mistake, 2,000 is more than enough.
Put it this way, and believe me when I tell you, I completely understand the ramifications of having to enforce a suspension on you, because ultimately, again, if we are to go against our regulations and just kind of let you skirt it after you've already served the suspension, and now you just barely missed a $5,000 fine and a 30-day suspension. So, again, the commonality here is that it continues to happen. You know what I mean? And that's kind of the issue that we take with the whole situation. Because ultimately, you've been a very forthcoming guy. You've come and talked to me many times about the situations, and and you're promptly paying your fines and you're trying to do the right thing. But ultimately, when you have a situation like this, it's our hands are kind of tied as far as being able to just say, okay, well, maybe next time, just be more careful. So, Madam Chair, I don't know if you have any additional thoughts or anybody else from the board.
No, I mean, I wish things were different, but, if we do, we can't set a precedence. The regulations are what they are. And they were well thought out when we made them. And the whole idea was that just knowing what the regulations were and knowing what the repercussions could be was supposed to be enough to deter these things from ever happening. And, I'd love, Joyce, that we're not in the business of running a business. And so these regulations are set forth, and it's really up to you to explain how, impactful it is to your business if your employees don't follow through. And like I said before, I'm being redundant. I hate to be the one that has to say, we're gonna, we have to follow through. We can't set precedents and just saying, oh, well, we like you. We know we like you. Because if the next person comes along, they'll say, well, you gave Malik a break, you're not gonna give me a break? And how can you do that when the regulation is here and it sets right there before us?
With that in mind, because you see the direction of the board is in, I would say that the regulation has a discretionary time period for said suspension, that it's not an automatic 7 days. So again, hearing what we had from Mr. Hyatt, from the members of the board, as far as them much more knowledgeable about the circumstances in that location, I would simply ask that the board utilize that discretion and try to come with a compromise that not only accomplishes the goals of the board, but doesn't create such an economic detriment that it forces the closure of the store indefinitely, if not permanently.
Just to the board, your regulation says shall. There is no discretion. Your local regulation says shall.
It does not. It says 1 to 7 days.
That's state law.
That is what is in the notice published by this board that was given to my client. So,
which is reflection of state law.
Okay.
But local regulations have a set time.
But at any event, so again,
we wait until the hearing is
what we can, I mean, you know, I mean, like I said, Malik, this isn't something that we're trying to do just because, you know, it's Blue Moon Smoke Shop, okay? Again, like I mentioned before, the commonality is that it has happened now 4 times within the last 3 years, you know what I mean? And it's, or just over 3 years. And, you know, again, the issues that we have, and while we do appreciate the fact that you are taking these precautions as far as the, the extent of what you're doing down there. I mean, whether or not you have a buzzer at the door and you have a bouncer and you're checking IDs going in, you know, I mean, that's something we can work on with you. But I mean, ultimately, it's something that we need to, again, it's a zero tolerance type of thing when we're talking about a tobacco violation to a sale of a minor. I mean, if there were other...
And the thing that really sits with me is it's an adult-only establishment. These kids should not be getting in, period. And that's something you're really gonna have to work on, because if your employees are not letting the under 21 in there.
But they have to walk in to check the ID to make sure if they are 21 or not.
Well,
you cannot have a bouncer in a smoke shop on the gate. And
if, like we said, you know, I know the like the marijuana places, they won't even let people in without checking their ID. It's something that needs to be thought about.
But financially, ma'am, that's a big difference between the dispensary and the small smoke shop.
But if they're not going to check IDs at the counter.
Well, you know what, ultimately, Malik, what we're talking about is, you know, the last suspension that you served. You know, we were in there, and you seem to have, you know, I'm sure that the tobacco aspect of sales over there is kind of your bread and butter as far as the amount of money you're bringing in. You did have product over there, you know, as far as the hemp and whatever else you might have, you know, the glass and all that stuff. I mean, you know, we're shutting down the tobacco aspect of the shop. You know what I mean? So that's something, and again, I mean, we're talking about a 7-day period here. So it's also something that we can work with you on when you serve the suspension as well. So I mean, my recommendation would be to start, you know, make it easy, start on like November 1st and something like that and end on the 8th. But, you know, it would be a clean week as far as when we started and when we finish the suspension. But also, again, I mean, like I said before, when we were in there talking about the last suspension that you served, you know, it seemed like there was a lot of product in there that you were also selling, you know, on, you know, next to the tobacco.
Yeah.
So, you know, I mean, ultimately, again, depending on what the board feels this evening, my recommendation, again, would be to enforce the 7-day suspension and have it begin on November 1st and end on November 8th.
Okay, do we have a motion?
Yes, in light of the second violation and the recommendations that I've heard, I make a motion for a 7-day suspension.
Okay. Chairman seconds the motion of a violation for 7 days starting on November 1st to end on November 8th. All in favor?
Aye.
Aye. Motion passes 3-0.
Thank you, members of the board, for your
Thank you.
consideration.
Thank you.
Thank you.
Thank you.
Malik, we'll talk offline.
Thank
Okay?
you. Yeah.
Thank you.
There's nothing else from me.
Thank you,
Good
Joyce.
night, I'll see you on the
We'll see you next
4th.
month.
Okay, thank you.
All right.
Oh, jeez.
That wasn't yours, Joe?
Thank you, good catch. I would have known when I got
Do
out.
we need
of
a
the
motion
car.
to suspend the hearing? Do we need a motion to suspend the hearing?
Yes, please.
Okay.
Motion to suspend the hearing for Super Petroleum until next month?
Second on the motion to suspend the hearing for tobacco suspension and Super Petroleum. All in favor? Aye. Motion passes. We will have that hearing on November 4th.
Yeah, like I mentioned, Madam Chair, I'll bring something down and mark it as hand-delivered, just so they definitely have something
Thank you,
in their
John.
hand.
All right. Next up, we have Teresa, the Public Health Nurses Report. That was painful.
I'll make it quick. This has been a long night. So we'll start off COVID.
Okay, sorry.
Oh, that's okay, no worries. COVID numbers are going up. This is typical, the highest levels that we've seen since last September 2023, which is, like I said, typical after summer travel, school starting. I want to let people know that there are free tests here at the library or at the senior center. We're also entering flu season. We had one flu clinic at the senior center. We had almost 100 people come. We have another one on 10/23 at Town Hall from 11:30 until 5. We will also have COVID vaccines and, again, free COVID tests. One per family we ask that people take. We have VNA services at the senior center coming once a month. They're there to answer questions, take blood pressures, blood sugars, help with medications, any other things that seniors need. It's been successful and the seniors really like it. Just want to touch upon Triple E in West Nile because this was a big topic over the summer. Numbers are obviously decreasing because of colder weather. We see a decrease in Triple E. Saugus remains at a remote level for Triple E, meaning that it's not usually found in this area. And then in October, we see the numbers usually decrease for West Nile virus. I still advise people to wear long sleeves and pants outside, even if it's hot out, and especially apply bug spray after dusk. Risk level for the West Nile, it has come down from a high to moderate in Saugus, so that is good. And that's all I have.
Just a
yeah.
quick question.
Yes.
You're saying COVID's going up since
Yes.
since
Last,
2023,
yeah.
yeah. And I know the wastewater treatment plant, the Deer Island measures it.
Yes.
Are we seeing those same spikes?
So that's where I got the numbers.
Oh,
so
okay.
yes, you don't really trust the numbers because everyone has rapid testing now, and so you can't really, so that's where I got the numbers here. So yeah, it's the highest in September last year.
Thanks, Teresa.
Yep.
Oh, I do have a question, Teresa.
Yeah.
Are the flu clinics well attended?
Yes, so we, almost 100 people at the senior center, and we're suspecting that there'll be a lot in October.
And
23rd.
I didn't know if you said, are you doing flu and COVID vaccines?
Yes.
Thank you.
Yes.
Great, thanks. All right, I would encourage people to go out and take advantage of that.
Yes.
Get your vaccine boosters. And last but not least, John, take it away. I'm dying to hear.
Yeah, in lieu of my usual exhaustive report, I only have a few things.
Come
So,
on.
As I mentioned, our admin retired on the 27th, or excuse me, the 30th, so last Monday was her officially last day, even though she had a vacation day. Thanks a lot, Lise. So,
You think she's watching?
I'm gonna make sure she's watching. So we do have a couple of things. It was a little bit more, we were kind of brought in as far as, just kind of focusing on making sure that administratively we kept the ball rolling and stuff. And like I said, Carly's been great so far. So, a couple of things. So as mentioned, Triple E, the levels are dropping, and West Nile is dropping just due to the fact that it is becoming colder outside. So we are starting to see a dip in the number of positive samplings as well. We haven't received any new human cases as of late, so everything seems to be on par to hit the first frost, and we should be all out of the woods there. We do have a couple of things. So I was contacted by the State Department of Housing and Community Development. So the Chisholm's Motor Inn is going to be, the Lynn Shelter Association runs a site at the Chisholm's Motor Inn, and they notified me that they're going to be relocating 32 families from Saugus over to Lynn, and so that move should be happening at the end of October. The Department of Education is going to be reaching out to the Saugus schools as well as Lynn schools about the enrollment status for 10 or so school-aged children, but they're going to keep us in the loop as far as what the next steps are going to be, but that site will be shutting down at the end of October. We still are going to have 3 active sites at Colonial Traveler, at the James Motel, and at the Avalon Motel on Route 1. We cracked down on 3 unpermitted sites that had a number of chickens over the course of the last month. The most recent one, we had a situation where a gentleman had 40 chickens that showed evidence of mange and disease. So we did make sure that he's surrendering them to the MSPCA and the Animal Rescue League. We've given him a allotted amount of time. I believe he was using them for processing. So, you know, I mean, we told him that it was like, listen, you either eat them or you get rid of them, you know, but there's only 2 ways of going about it because the neighbors started complaining that they were burning the material that was in the coop and things like that. So we did kind of crack down on that particular situation. We did let them know that it is, you know, it's legal for them to have permitted chickens as long as they abide by the regulation. But 40, you know, I mean, some of them didn't even have feathers. It was a rough scene. So they're going to be surrendered over the next 2 weeks. We've done a preliminary review for a Mexican restaurant down at the old Esposito's Bakery site. Let's see, prospect of there's going to be a butcher shop. There's been some inquiries regarding a butcher shop at the Hamilton Street Plaza at the old La Vida Mia, I believe it was called, or it's next to 7-Eleven or what have you. But they've been asking some questions about how to outfit change of use for that particular application. The one obviously kind of resounding thing is whether or not they're going to be able to connect to a grease trap there. So we've requested a certified floor plan and stamped architectural drawings for what they plan on doing over there before we kind of let him move forward. And I give the guy a lot of props because he's actually doing his due diligence versus some of the other businesses in town that have just kind of signed the lease and been like, well, what do you mean I can't start? So it's just, it's a refreshing thing to see that some folks are going the extra mile. We have issued several septic hauler permits in the month of September. And one other thing that we're kind of running into as far as this particular situation with a temporary permit. So a entity called Backyard Butchers has been calling and requesting a temporary food permit. So we, requested the usual documentation, I mean, the serve safe, the copy of any permits from Massachusetts. They were able to provide all of that. What they didn't provide, and it's probably an oversight on our part, but we looked at the address that they were going to be, spotting up at for a week, and we were under the impression that Ocean State Job Lot was running some type of promotion. So, we went down to issue the permit, and they're all set up, and they have their reefer truck and the tent and all that stuff, big line, and, we walk up, and there are representatives from Ocean State Job Lot out there, and I'm like, okay, well, what do we got? And so it turns out that they never had permission to be there. So we made them pack up, and we're like, well, yeah, I mean, geez, so like I said, it was kind of a little bit of an oversight on our part, considering that it was trying, I considered it to be a promotion that Ocean State was running because, I mean, they were advertising on the radio, a lot of different stuff for this particular site. So, we were under the impression that they had full permission to be there. Anyway, so they've reached out for an additional permit. They have claimed that Simon Property So Square One Mall has given them permission, so we're requesting written authorization before we move forward with anything else.
What do they do?
They sell like frozen steaks and frozen crab legs and stuff. Honestly, I mean, I went down there and I was like, it's too bad because a lot of the stuff looked really good.
Yeah, okay.
So, but yeah, so like I said, we're just awaiting some more written authorization from Simon Properties prior to issuing any type of permit, and I spoke with the building commissioner regarding it, so he seems to think that the selectmen also need to get involved because of the temporary status of the business, but I mean, it is a food establishment permit that we'd be giving out, so I'm gonna reach out. I wish Mr. Sereno was still here because I'd like to talk to him about it, but yeah, so we're just gonna reach out for some more guidance prior to issuing any permits for it, just because it was shrouded in controversy to begin with. Yes,
they're going to work out of their truck?
So yeah, so they had a kind of a, I mean, the set.
Out of your trunk.
Well, the setup. I mean, the setup was actually a very legitimate setup. Really? You know what I mean? Ultimately, so I believe the issue is now becoming whether or not the advertising involved is allowed because they're spotting up on a, whether or not it be Route 1 or wherever they're going to. I mean, there's giant banners like on the side of the. On the side of the truck. So I'm sure they're trying to get involved as far as, as far as the advertising aspect is concerned, because it might be a zoning
It's
issue.
more than like a food truck, because food.
It's not a food truck. I mean,
Right,
essentially,
it's not a food truck.
It's just this, it's a rolling freezer, essentially.
Right, so, I mean, it takes, I think you do need to
Yeah, so
go a
we're-
little further,
yeah,
like it's
so
more
we're
like
gonna-
a business.
Yeah, so we're gonna dive a
Okay.
little deeper into it, but like I said, I mean, my initial thought was that it was just a random promotion that Ocean State was running, because you hear it on the radio. They're like,
Right.
oh yeah, we're gonna be down here, and I'm like, okay. So,
Interesting.
so yeah, that was
Temporary,
interesting.
do you mean mobile or is this
Yeah.
short term?
So short, so a temporary food establishment would be considered anything under 7 days, or 7 days max.
That's the business model?
What's that?
That's their business model?
No, well, I don't know if it's their particular business model. That's just how long the extent of the permit was that we were going to issue. As far as I mean, so it's a $50 a day permit. So essentially, from our end, it would be, you know, I mean, as long as, I mean, you see it with like farmers markets and
Right.
all types of seasonal stuff. So I mean, like I said, it looked good, but they didn't follow any protocol. So we're gonna, you know, make sure they don't do it again until they're ready. I mean, the guy had no idea too, which was pretty funny, because he was just sent there by his superiors, and he's just, you know, so he's sitting there losing his mind. So it was a comical situation, because they were kind of amicable to the idea that they had to shut down, you know, so they weren't like fighting us on it or anything. But he's like, oh my God, like I had the permit for here.
Oh my God.
So it was interesting, but like I said, we're gonna wait to hear a little bit more about their situation before we let them spot up anywhere. But that's my whole report.
Never a
Madam
dull
Chair.
moment, John.
No, of course not. Never ever.
All right, well, do we have any questions from, hi, how are you?
Hi.
Come on up. Could you just tell us your name and address again?
Sure, Jackie Mercurio, 255 Lynn Fells Parkway. I had a comment and two questions, I guess. First comment was, through Mass DEP's visit, I wanted to make a recommendation to place the Board of Health, push to place the air monitors over by the ITM, which would be the second option option B that we visited. I just felt as though that was pulled as far away from the traffic and GE and other things. So if it does become a option with electricity and
Sure.
National Grid, I
Yeah.
hope the Board of Health will take into consideration those
Sure.
those
Thank you.
feasibilities. Second thing was, in Wind Waste report, they reported the fire of the compost pile. And I was a little concerned because their permit, they were issued in 2018, says that as of 2023, the compost pile was to be eliminated in their different phasings. So I didn't know why that operation was still continuing. It must be under a different permit, but I couldn't find it. But that also leads me to my last comment in follow-up to Mr. Durant's questions about closure. I know when Mass DEP was out to visit Revere and Saugus, they talked about the closure process, and I specifically asked when the closure process started. The Mass DEP said they would be starting the process of overseeing the closure process in January of 2025. And I asked if we could somehow incorporate the town of Saugus and the Board of Health into the closure process to open up the communication. So time is fleeting, and we are almost to January of 2025. So hopefully we can work on getting the Board of Health to open some avenues in conversation with Mass DEP regarding the closure plan.
Absolutely.
I know there are some items to tick off and check off for the permit, and it would be awesome if the town could participate in that
Look into all
process.
that. All right. Thank you. Keeping us in line as usual.
Sorry.
No.
Thanks.
Good information.
It's great. Thank you. Anything else? Yeah. All right.
Just the, the flu clinic's going to be open to the public on October 20th. I'm ready to get out of here.
It's a late night.
October 23rd from 11 to 5 up in the Town Hall Auditorium. It's going to be open to the public. We'll have the most recent Pfizer COVID booster, as well as the most recent seasonal flu vaccine, as well as COVID tests for anybody that wants them. So come on down and get your flu shots.
Encouraged. All right.
Interrupt, but it's 5 minutes to 8.
We're closing out right now. Okay?
Look at that.
So-
Kicking us out at the same time. It's awesome.
Well, that's it. It's good timing. So I'd like to motion to,
Motion to adjourn?
okay, and I will, we have a second. So the close of our Board of Health meeting for October 7th. We will reconvene on November 4th, I believe.
That's correct.
For our November meeting. Meeting's adjourned.
Beautiful.
Good night, everybody.